Kuzampola and welcome to everyone to my YouTube channel. Firstly, I would like to thank you all from the bottom of my heart for liking, watching, sharing and subscribing my YouTube channel. And if you haven't done, subscribe my YouTube channel. Just click a subscribe button which is right below me to get updates on health and other things from my YouTube channel, which would in fact and indeed benefit you, your family members, and everyone across our communities. And I value your time. That's the reason I bring the content which is informative, which is invaluable to you as you watch the YouTube channel. And in today's video, I will be taking you through 5 questions of postnatal care services that would clarify the doubts that you have in your head. So, in my previous video, I talked about pregnancy care and institutional delivery. Now, right after a mother has been pregnant for 9 long months and delivered a child in hospital, then what next? So in this video, I'll be talking about postnatal care services, afterbirth care services, which is again another very integral component of mother and child health care services. So I'll take you through 5 important questions that would maybe answer all the doubts that you have in your mind. So the first question that I have is, what is postnatal care? So the postnatal care is a health care that is postnatal care is a health care for both mother and a baby, starting from childbirth until 42 days or the first 6 weeks of child's life. 42 days is equivalent to 6 weeks of life. The health care that is provided to both the mother and the children from 0 days until 42 days of after delivery and the first week of child's life is called postnatal care. Now, the next question that I have is, how many PNC visits should a mother attend? Again, this is another very important. As per the national policy, there exists a recommended 4 antenatal care. 4 times a mother should visit to hospital for postnatal care services. That is in third day after delivery, on the 7th day, and on the 21st day, that is equivalent to 3 weeks, and on the 42 days, that is in 6 weeks. So within the 4, normally postnatal care checkup must be done at 3rd week, 7 weeks, 21 days and 42 days. That has 4 postnatal care checkup services. So it is very important that mother come for all 4 postnatal checkup services. Now the next question that I have is, why postnatal care is important? Why postnatal care is important? As I've already talked about, and so I've showed you that there are 4 postnatal care services. Now, majority of maternal and neonatal death occurs within 0 to 42 days, which means there is high risk of maternal and neonatal death within this 42 days, and this is the most neglected period. So in that case, in order to ensure the swift recovery of mother after childbirth, early diagnosis and timely treatment, postnatal care service is very important. And to ensure healthy and happy start of newborn's life, that's why postnatal care is important. Therefore, postnatal checkup services will allow us to have a close monitoring of both mother and baby to ensure the healthy and happy start of both mother and the newborn. That's why postnatal care is very important. And the fourth question that I have is, what checkup services are provided during PNC? Now, what checkup services? Let me take you through the acronym of ABC. ABC. Here is mother's ABC, here is baby's ABC. Using the acronym of ABC, I will be explaining you the services that are rendered at hospital during postnatal period, postnatal check services. Like in mother's, let's look at mother's case. A for assessment and advocacy. In mother, we do assessment of vital signs like blood pressure, temperature. We even weigh mother, and we check height of fundus. We check cesarean mark scars. We check the sign of infections in the mother. We do assessment closely of the mother, and advocacy. We advocate mother in exclusive breastfeeding, immunization, family planning, and growth monitoring of the children. We advocate about the mother. And in B, we assess B for breast bleeding and blood test. We check the mother breast. Mother breast is one of the most important organ during after delivery, because it serves as a food. It serves as a survival medium for the children. Therefore, breast to assess the infection, swelling, and bleeding. If there's bleeding, the mother could die. That's why blood tests like hemoglobin is carried out in order to determine the level of the blood in the mother's body. And C for curative services. We do supplement vitamin A after delivery and iron tablet for 3 months after delivery. Curative services so using these are the acronyms that determine the postnatal care services after delivery. And baby's ABC of services. What do we do to a baby after delivery during postnatal period? Let's see. A, B, C again. A for airway, nose, mouth, whether the nose and mouth is clear. That's very important in a children. Airway, whether the airway is clear or not. Assessment. We do assessment of a baby like checking thermometer, checking temperature, checking respiration, and heart rate, which is very very important. And B for breathing, we check breathing and breast milk. And the two most important vital signs in the baby, vital signs in the children, is respiration and heart rate. We can determine whether the normalcy of the breathing in a children in postnatal checkup. And breast milk, whether the child is being adequately breastfed or not, through asking urine and stool output during the postnatal period. And C for circulation, color, and care. As I talk about circulation, there are pulse, their heart rate, and breathing that determines the circulation in the body. And color, skin color, to check the jaundice and also other infections. And care, like there's umbilicus that can be a cause of infection for the children. We also do a care assessment of the umbilicus. All these are checkup during the postnatal period. And the fourth most important needs that after delivery for the baby is like warmth, the breathing, and breast milk, and the prevention of infection, which is very important. Therefore, to ensure that this becomes very critical during postnatal period. And these are the service packages that we render during postnatal period. And the final question that I have is how long should a home mother exclusively breastfeed her children? How long should a mother exclusive? I think everybody is aware of this. We exclusively breastfeed the mother. We encourage every mother to breastfeed their children for 6 months. 6 months exclusive breastfeeding. When I say 6 months, for 6 months, mother need to breastfeed the baby. There are so many advantages of breastfeeding. Let me just tell you a few. Like one, initiation of early breastfeeding after delivery will reduce the chances of hypothermia and hypoglycemia and hypothermia in the children through skin to skin contact and early breastfeeding measures. On top of that, it also releases oxytocin in a mother that will help contract the uterus, thereby stops bleeding, thereby preventing the condition called postpartum hemorrhage. Therefore, early initiation of breastfeeding is one of the important components of postnatal care services. And the reduced chances of ovarian and breast cancers in a mother, and it develops attachment and bonding between the mother and the child. These are the advantage. Breast milk is the perfect food, perfect combination of vitamins, carbohydrate, protein, and fat in a mother that can help grow uh, optimally and soundly in a children. Therefore, breastfeeding is very, very integral in for the growth of both baby and the children. Therefore, I would like to I would like to encourage everyone to exclusively breastfeed your children and come for postnatal care services. Therefore, I would like to once again request everyone out there to encourage every mother to come for postnatal checkup services, which is very important. Now, ABC of the children is airway, breathing, circulation. ABC of a mother is attachment, bonding, and compassion. It develops naturally, and the ABC of father is being amiable, being brave like a father becomes a protector, and C is caring. Father need to be caring so as to ensure the healthy start of both mother and the baby. Thank you for watching my video. Have a great day.